My dear students, the lecture which I am going to deliver today is about the electrical activity of the heart. And the heart is suspended in the thorax and it emits the electrical waves in the form of a potential difference which is recorded by the surface of the body by means of the various electrodes and which records the electrical activity of the heart. See, the heart and every excitable tissue has got two types of the activities. One is known as a electrical activity and the other is known as the mechanical activity. The record of the electrical activity is known by ECG, which is the electrocardiograph or the electrocardiogram. ECG is defined as recording of electrical activity of the heart on a graph paper. See, whenever I talk on the ECG, EEG or EMG or the spirogram, then I quote one idiom necessarily. That idiom is in between the lines. In between the lines in Urdu, it means bain sutur. So what is hidden between the lines? And I came to know, no doubt, whenever you read a paragraph, something is hidden in the form of a meanings, comprehension. In between the lines, bain sutur, कि इन सतूर के अंदर क्या छुपा है, इन लफ्ज़ों के अंदर क्या छुपा है. लेकिन मैंने इस इडियम को इलेक्ट्रोकार्डियोग्राम में, इलेक्ट्रोएन्सेफलोग्राम में, स्पायरोग्राम में और इलेक्ट्रोमायोग्राम में इसको बहुत सच पाया. Because these are the lines which are comprehended in the various forms of electrical activity, mechanical activity, the activity of our lungs, excursions. So ECG is defined as a recording of electrical activity of a heart on a particular graph paper, the glazed paper, which has got a very shining surface and which is chemically treated, and it has lines in the form of a graph, which has got x-axis and y-axis, and quantities which are calibrated on this graph paper are on the x-axis, there's a duration, time, and on the y-axis, there's a voltage. Graphical representation of electrical activity of the heart is known as a ECG. The machine which is used to record the electrical activity of the heart is known as an electrocardiograph, and the record is known as an electrocardiogram. ECG machine and power lab is also nowadays a new device, power lab, also used for the attainment of this electrocardiogram, the electrical activity graph of the heart. Well, you are looking here, the machine, the subject or patient, how it works, and you are knowing these are the electrodes, these are the wires which are attached to the ECG machine. This is the ECG machine, and these are the chest leads, these are the arm leads, and this is all the connections of the ECG. The graph on which the electrical activity is recorded is called electrocardiogram. Significance of ECG. ECG gives information about rate and rhythm of the heart. Heart, what's the rate of the heart? How many beats per minute? As you know, the normal heart rate is 65 to 75 beats per minute. And the rhythm of the heart, whether it is contracting in a regular rhythm or the rhythm is irregular, is very much important. These are the information which we get from the ECG. The physical orientation of the heart, that is its axis. How the heart is placed in the part of the thorax. Its diagnostic tool for various heart conditions like hypertrophies, ischemia, infarction, arrhythmias, conduction problems, and pacemaker activity. The aberrations of the pacemaker and the aberrations of the conductive system. ECG does not provide information about mechanical activity because it is a record of the electrical activity entirely. ECG paper. This is a long roll of paper composed of small squares. One square is 1 millimeter wide and 1 millimeter high. On ECG paper, there are thick lines. Between two thick lines, there are 5 small squares. The speed of ECG machine is 25 millimeter per second. This is a very international sort of information. The speed of ECG machine is 25 millimeter per second. Now you are looking here. These are the smallest one is 1 millimeter high, 1 millimeter wide, and the largest is 5 millimeter, having the 5 smallest squares, and the rate of the machine is 25 millimeter per second. 25 millimeter per second means these 5 large squares will be elapsed in 1 second. This is very much important. On this one smallest square denotes 0.04 seconds, and it denotes 0.1 millivolt. Yes, you are looking here. This is a record of the ECG. You're looking here. This is a 0.5 millivolt, the large square having a 5 smallest square, and 0.20 seconds. Now you're looking here at the P wave, the Q wave, the R wave, the S wave, and the T wave. And the distances between these waves, they are given certain names. Start from the P to the start of the Q is a PR interval. And then the end of the S wave and the start of the T wave is known as ST segment. And C, from the start of the Q to the end of the T, Q2 interval is again very much important. So looking here, this is how ECG is recorded. The P waves, the QRS complex, then the T wave. These are known as, जैसे कहते हैं ना कि मोटी waves, which are comprehended in the first glance. They are the P wave, the QRS complex, because the complex of 3 waves. Then comes a T wave. Now you're looking at ECG paper dimensions. This is the large square. It has got 5 millimeter on each side, and the smallest one has got a 1 millimeter wide and 1 millimeter high. In terms of a second, you're looking here. This is the smallest one, 0.04 second, and the large has got 0.04 multiplied by the 5, 0.02 second. And the voltage, 0.1 millivolt. Voltage here. Speed is 25 millimeter per second. It means the large squares in these sides, they will be elapsed 5 per second. The time interval of each small square can be calculated as 25 small squares are equal to 1 second. 1 small square is equal to 1 by 25 second. That is 0.04 second. These are dimensions of the ECG paper. Vertically, the small square represents the amount of electrical potential in terms of a voltage. My dear students, my talk on ECG paper, and that's going to be started. One thing I must mention, that the source of all my lectures on the physiology, whether it is neuromuscle or it is a ECG or any other topic for the first year and second year. Source is doubtlessly the textbook of physiology by Guyton, and also review of the physiology by Ganong, and essentials of physiology by Professor Mushtaq Chaudhry, the legend of Pakistan regarding the discipline of physiology. Well, I'm talking on ECG paper. The time interval of each small square can be calculated as 25 small squares are equal to 1 second, and one small square is equal to 1 by 25 seconds, that is 0.04 second. ECG paper, vertically the small square represents the amount of electrical potential. One small square represents the potential of 0.1 millivolt, and 10 small squares represent the potential of 1 millivolt. You're looking here, these should be on tips that the ECG has got P wave, the Q wave, R wave, S wave, T wave, QT interval, and see your this P wave, the Q wave, the R waves, the S wave, the T wave, and see this is the QT interval, this is the PR interval, and this is the PR segment. Difference, see the start of P wave and the start of Q wave, it's a PR interval. The end of the P wave and the start of the Q wave is the PR segment. Then this segment is very much important, which is here at the end of the S wave and the start of the T wave. ST segment is a very much significant part of the ECG because its elevation and its depression both are diagnostic. Then this the QR is complex. See, this is the graph paper, and the waves are depicted in such a manner. Leads are electrodes which record electrical potential of heart at different sites. There are 12 ECG leads, 3 bipolar limb leads, 3 augmented limb leads, unipolar they are, and 6 chest leads which are placed. See, these are the leads. These are the right arm, left arm, the left foot, and this is the neutral, the right foot. And these are the leads, and there is an acronym, read your green book. Read your Y for the yellow. Read your green book. The red on the right arm, the yellow on the left arm, the green on the left foot, and the black on the right foot. This comprises the bipolar's limb leads. And see, this is the angle of Louis, which is the landmark to place these leads, which are known as chest leads. V1 to the the right side of the sternum. V2 left side, V3 left side of the sternum, V4, V5, V6. And these are the intercostal spaces which are very much important. V1, that is close to the sternum on the right side, and that is the 4th intercostal space. And in the 4th intercostal space, in the same line, that is the V2. V4 is placed in the mid-clavicular line in the 5th intercostal space, V4. Now V2 and V4, इनके दरमियान हमने V3 प्लेस करना है. It might be on the rib, it might be in the intercostal space. ये याद रखिएगा कि V3 जो है V2 हम प्लेस करते हैं to the left side of the sternum in the 4th intercostal space. ये 4th intercostal space है, और V4 हमने प्लेस किया in the 5th intercostal space, and this is in the mid-clavicular line. Yes, perpendicular drop from the mid of the clavicle. Now, the V5 again in the anterior axillary line, and it is in the 5th intercostal space, and V6 in the mid-axillary line in the 5th intercostal space. This is very much important. Or most of the leads, V4, V5 and V6, They are placed in the 5th intercostal space, and V1 and V2, they are in the 4th intercostal space, and V3 in between V2 and V4. Bipolar limb leads. Lead 1 comprises left arm plus right arm negative. The positive connection to the left arm, the negative to the right arm. Lead 2, right arm negative, left positive. Lead 3, left arm negative and the left leg positive. It means the right leg does not take part in the formation of these bipolar limb leads. They have got lead 1, lead 2, 3. Left arm positive, right arm negative, lead 1. Right arm negative, left leg positive, the lead 2. Lead 3, left arm negative and left leg positive. You are looking here. The standard limb leads. This is a right arm ever negative in the lead 1 and in lead 2. Right arm is ever negative. The right arm negative, the left arm positive, lead 1. Right arm negative and left leg positive, lead 2. The left arm negative and the left, one thing is also comprehensible. This is also noticeable rather, notifiable. That is the right arm is ever negative and the left leg is ever positive. But the left arm, it has got a heterogeneous behavior. In the lead 1 it is positive and in lead 3 it is negative. You are looking here. Now precordial leads. Precordium is basically that part of the thorax which is right on the anterior aspect of the heart. This angle of Lewis. See, this is the angle. Mid-clavicular line for the lead 4, mid-axillary line for the lead 6, and this is the anterior axillary lines. Augmented limb leads, AVR, A stands for augmented, attached to the right arm. AVL attached to the left arm. AVF attached to the left foot. See, you are looking here again. These are the records of these 12 leads. Lead 1, lead 2 and lead 3. AVR, AVL and AVF. V1, V2, V3, V4, V5, V6. This is all the recording of the machine that goes on. This is the most common and prevalent pattern of the machines nowadays. Summary of the leads: bipolar leads, limb leads 1, 2 and 3. Precordials, no, unipolar. AVR, AVL, AVF, and keep in mind the precordial leads are also known as the unipolar leads. The AVR, A stands for augmented, AVR, AVL, AVF, these are the augmented leads, and V1 to V6, they are also the precordial leads. This is the Einthoven's triangle. Einthoven is the father of the ECG. He is a man who rather invented this device, who formed this device. And Einthoven's triangle is there. You are looking here. This Einthoven rule also, right arm, the left arm, the left leg. And these are the directions. The AVR, AVL, AVF. Lead 1, lead 1, lead 3, lead 2. Einthoven's triangle, Einthoven's rule is the lead 1, lead 3 and lead 2 is equal to 0. That means the lead 1 minus 2 plus 3 is equal to 0. And if we add lead 1 and 3, that is equal to 0, is equal to 2. The amplitude of the QRS complex in lead 1 and amplitude of QRS complex in lead 3, that is equal to the amplitude of the QRS in the lead 2. Einthoven's triangle. Einthoven's triangle is a My dear students, I'm talking in continuation on the topic of ECG, and this segment of my lecture is concerned with the Einthoven's triangle. Einthoven's triangle is a diagrammatic way of illustrating that the two arms and the left leg form the apices of a triangle surrounding the heart. It is an equilateral triangle. Equilateral triangle. Einthoven's rule is there. Einthoven's law states that if the electrical potential of two leads are known at any instant, the third can be determined by simply summing the first two. This is the Einthoven's rule, Anatomic Groups. Looking here, the lateral is recorded by the lead 1. Inferior part of the septum recorded by the lead 2 and 3. AVR is not concerned. Septum, lateral part of the septum, inferior part of the septum, V1 septal, V2 septal, V3 anterior aspect of the heart, V4 anterior aspect of the heart, and this is the lateral, this is also the lateral part. The leads record which side or which part of the heart that is notable in this slide. Lead 1 depicts lateral side of the heart, lead 2 inferior side of the heart, lead 3 also inferior. AVR none, it's not depicting any part considerably. AVL, that is meant for the lateral side of the heart, AVF for the inferior, the V1 for the septal part of the heart, V2 also for the septal part, V3, V4, they denotes the electrical activity in the anterior part of the heart. V5 and V6, they depict the electrical activity taken and it is recorded from the lateral aspect of the heart. Then comes the anterior wall. Again you are looking here, one lateral, second inferior, third inferior, AVR none, AVR lateral, AVF inferior. This is the anterior wall record. The lateral wall, you are looking here, the whole lateral wall is recorded by which lead? The lead 1, lead AVL, lateral V5 and V6. See, these leads depict the electrical aberrations or the electrical activity, normal or abnormal, from lateral, 1 lead, AVL lead, V5 and V6. You have to see the changes in the lateral wall in these leads. Then comes the inferior wall, 2, 3, AVF. These are the leads which are specific for the changes in the inferior wall of the heart. Summary: 1 AVL, V5 and V6 for the lateral wall, 2, 3 AVF for the inferior wall. The AVR does not depict any side. Then comes the V3 and V4 anterior wall, and V1 and V2 the septal electrical activity of the heart. Waveforms in ECG. It's the other lecture which I am going to summate with my previous lectures. Always remember, positive electrode is always a reference electrode. Depolarization wave moves towards the positive electrode, gives positive deflection. Depolarization wave move away from the positive electrode, gives the negative deflection. ये एक generalization है. Note it. Positive electrode is always a reference electrode. Depolarization wave moves towards the positive electrode, gives the positive deflection. ये positive deflection means पॉजिटिव लाइन आएगी, आइसोइलेक्ट्रिक से ऊपर इसकी डिफ्लेक्शन आएगी. और अगर डीपोलराइजेशन मूव अवे फ्रॉम द पॉजिटिव, इलेक्ट्रोड गिव द नेगेटिव डिफ्लेक्शन बिलो द आइसोइलेक्ट्रिक लाइन. इसको हम नेगेटिव वेव भी कहते हैं, उसको पॉजिटिव वेव भी कहते हैं. वेव फॉर्म्स पी वेव, इट इज द एट्रियल डीपोलराइजेशन. QRS complex, it's a ventricular depolarization. T wave, it's a ventricular repolarization. You should know the electrical activity is remembered by these words: depolarization and repolarization. The current flow is the depolarization and the normalcy attainment is the repolarization when the wave forms come to the baseline. Basic terminology: baseline, flat, straight, and isoelectric line. It is the baseline. Waveform, deviation or movement away from baseline may be upward or downward, इसको हम waveform कहते हैं. Segment, a line between two waves, उसको segment कहते हैं. Interval, a waveform plus a segment. This shows time duration. Complex, combination of several waveform without segment is known as a complex. Again, baseline, flat, straight and isoelectric line. Waveform, deviation or movement away from baseline may be upward or downward. Segment, a line between two waves. Interval, a waveform plus a segment. This shows time duration. Complex, combination of several waveform without segment. Yes, you're looking here again. This is the sinoatrial node, the pacemaker. This is the pathway, conductive pathway, atrioventricular node. This is the bundle of phase, then Purkinje fibers, and these are the pathway of the electrical activity. See, you are looking here, the atrial depolarization of atria is the P wave, and this is the start of the P and the start of the PR interval. One, क्या कहा था? Interval, एक wave plus a segment. That is the interval. The start of a P and the start of a Q. It's a PR interval. और इसमें कौन से शामिल हैं? PR interval में शामिल है P wave और PR segment. Now then comes the Q wave, the R. Depolarization means upward deflection. Then the ventricular repolarization. Keep in mind T is a repolarization wave, but again it is upward. Then the ST segment and the QT interval. Start from the Q and end on the T is very much important. QT interval is a very much important wave. And this is the QRS complex. This record should be known by the every student. See, this is how the depolarization is the yellow and repolarization is the green. See, this is how the pacemaker is depolarizing. And this is the baseline and wave formation. Because the depolarization is going away from the positive towards the positive. Yes, this is the depolarized and it's a P wave. P wave means the atrial depolarization. It means both the atria are depolarized and depicted by the P wave. And no, both are the depolarized and it's the P wave. It's the P wave. Now, see, they are repolarized. It has come back. And the repolarization of the atria is embedded in the QRS complex. It is not shown on the graph, but it is somewhere embedded in the QRS complex. No, the wave is not going towards that. The atria has been repolarized, green, and the wave of repolarization is not shown because it has been embedded, because a strong QRS complex has taken that back. Now this is the depolarization of the ventricles, QRS complex. See, this is the QRS complex. Now the repolarization starts the T wave. T wave means repolarization, the green part. You're looking here, the SA node generates impulse. Atrial excitation begins here in the SA node, sinoatrial node, and then this goes like that. Currents emits internodal pathway where to the sinoatrial node, the SA node. The impulse delayed at AV node. Why? It is a very much important.